Etim Effiong Ayi. I'm the medical superintendent of General Hospital Calabar. By specialty a plastic surgeon, but I'm also a certified fistula surgeon. One specific policy that actually ignited us is the Ayade care, which specifically is supposed to mean the state health insurance policy, because this is a general hospital that sees some patients that will come in and cannot afford even a pint of drip that is as cheap as 200 naira. So the basic solution to that is nothing more than state health insurance policy, which Ayade care is actually taken care of, or is about to take care of when it's fully implemented. That works out in the sense that it's going to cover both the formal and informal sector. We know that already there is an existing national health insurance scheme which covers just the formal sector. That what it means, if you're not working, you're not a staff somewhere, you're not an employee somewhere, you cannot have access to national health insurance. But Ayade care is going to cover both informal and formal sector, and it will also get down to the community as well. Looking at the welfare, we talk about the salary structure. We talk about when staff has problems or issues, and how the management is catering for them, and how we bring them. Fine. Let's look at looking at the salary structure. That's for the Ministry of Health and for the government. But we know that we have a comprehensive salary structure, which is a COMES for the doctors and the COHENS for the nurses. And with the paucity of funds in the state, we've been able to, for doctors, we are being paid 70% of that, and nurses the same thing. So we are on that 70%, but the government has promised. So we are still pushing to see how far we could go. My plan, first and foremost, is to see that anybody that comes in here will be attended to in the shortest possible time. Adequate care will be given, and adequate services will be rendered. That's just my plan. My advice to His Excellency is that he had already started work by bringing up the concept of Ayade care and specialist hospitals that are going to serve as referral centers. And I want him to actually complete this and implement it so that the masses will benefit. On behalf of the management and staff of General Hospital Calabar and myself, I want to sincerely congratulate His Excellency Professor Ben Ayade and his dear wife, Dr. Mrs. Linda Ayade, on the success at the poll of the recently conducted election. For them to have had this landslide victory, it shows that they have what it takes to rule Cross River State for the next 4 years. Because those of us that were on ground, we saw a lot of challenges politically and otherwise, but he was able to overcome. So we say a hearty congratulations to him.
And here we are at General Hospital across Calabar, and we have one of the outfit that is being constructed by Lions International, courtesy of the medical superintendent. So he will tell us a little about this, and this come under his administration as the general medical superintendent.
For years, we've been having an NGO, the Tosi Chanrai Foundation, that has been carrying out cataract surgery free of charge, and one of the challenges is that they are occupying one of the theater suites in our main theater setting, which has also reduced the number of patients we work on in the general surgery and the gynae surgeries that we do. But the Calabar Canaan City Lions Club saw this as one of the challenges in the hospital, and came up, built this complex specifically for in the eye theater. Last 3 weeks specifically, and handed over to the hospital. This was commissioned on April 23rd, 2019, and it was handed over to the management of the hospital, and we've also handed it over to the Tosi Chanrai Foundation, who are going to be the end users of this complex. So by their words, we believe that by ending of this month, they should move in, and this complex will be quite functional. In other words, it's going to give us a huge space in the main theater for us to do our work properly. Looking at the indices, talking in terms of the maternal or perinatal mortality, as we say, is really high in Nigeria, and so every effort by every government like ours, who has so much passion to health sector, is to make sure that facilities that the mothers, and to reduce the mortality rate is also put in place. Here is a neonatal unit. In this unit, it's fully functional, well equipped. We could see that we have incubators here, we have phototherapy unit, we have the CPAP that is used to handle the children in respiratory distress. So with this, we've seen a lot of improvement in terms of children that are born with asphyxia, which before now had to be rushed to other higher facility, and sometime along the road hold up may cause a lot of delay, and at the end the child will not survive. But such cases are well taken care of because we are fully equipped in this unit. You could see this one is just to, in case
there's no water.
There is no water, not that we don't have water.
We have, even like that, I can open it for you.
Our water runs 2/4, but occasionally, as can be very unpredicted, the pump may have issues. Somebody can cut grass like they did last week and cut the wire. So the water will not come and water board is not coming. So we need a backup until they join the wire together, until they repair the pumps. So that's why we see this as a backup. So this is the labor ward proper.
central sterile supplies department of the hospital. We receive packs that have been packed in other units because this unit is not patterned as the ideal central sterile supplies unit. So since it's not patterned that way, we try to make the unit as an ideal unit. So packs are made from, some packs are made from other units, like the theater, they prepare their packs and bring them in here for to play them. But sometimes we pack the unit packs that have been used. So they bring them in here and we decontaminate them, repack them and sterilize. So if you care to know about the units here, I can take you. The sterile supplies unit is supposed to have 4 departments. 1, decontamination. 2, assembly. 3, sterilization. 4, storage. So here the building is not patterned that way. So here we receive sterile parts, decontaminate them, assemble again. That is almost 3 minutes. 3 sections, almost 3 sections here. Then we take them to the other section and sterilize them. Bring them back to this shelf and store them for supplies.
I am a nurse, a dialysis nurse here, General Hospital, working in this dialysis unit. My name is Mr. Ngodi Etowa Eku. So this place was commissioned the year 2012. And since then, we have been working here. And we have had a lot of sections. We have been having patients coming and going, coming and going. So we have 2 machines here that are very, very functional. This is the first machine. This is the second machine. This one is the aqua water treatment unit. So this one is the one that filters the water. This is the one that is producing the dialysis. This one. So we have there's another apartment there. Where we have the water, where we are treating our water. Where we have the filters. Everything. So any patient that comes here, we dialyze the patient, either in this machine or this machine.